The gentleman from Arlington, Mr. Hope.
Thank you, Mr. Speaker. I rise for the point of personal privilege.
Gentleman may proceed.
Thank you, Mr. Speaker. Mr. Speaker, ladies and gentlemen of the House, I was going to do a point of personal privilege yesterday, but I didn't think, given our busy schedule, it was appropriate. And I, too, would have picked the subject of the Washington Post editorial. The gentleman from Augusta, I think he's right. I was disappointed. In fact, I tweeted, maybe the gentleman from Augusta should start following me on Twitter, because I tweeted on Saturday, the Post posts their editorials the evening before, and I said, I'm disappointed the Washington Post is comparing Virginia's failure to expand Medicaid to massive resistance. I feel the exact same way. That was about race. This issue is not about race. It's about people that are poor and low income and who are getting sick. And they're our neighbors. They're your neighbors. There's 400,000 people. Now, I wish this debate weren't about Medicaid expansion or Obamacare. If we could just take that off the table and talk about how do we take care of the people in Lunenburg, where 1 in 5 of the people walking down the street are one accident or illness away from financial ruin or bankruptcy. That's the issue that we got to solve. That's the problem that other Republicans and Democrats come together and solve that problem. It hurts our economy when people are just that close from being in financial ruin. And why can't we as a body come together to have that discussion? It doesn't have to be Obamacare. It doesn't have to be Medicaid expansion. Let's come up with a Virginia way. Now, a couple of years ago, even last year, but the year before that, we did have debates, and there are clear differences between us. But I want to make very clear that the problems that we talk about with Medicaid are of our own doing. Medicaid has been in existence, since 1965, and Virginia shortly after that had expanded Medicaid to its existing program. And it is true, the costs are going up 1,600% over the last 30 years. That is exactly true. And let me tell you something, that's happening in every single state in the country. It's not because of us. It's not anything that we're doing wrong. And if you question why providers aren't accepting new Medicaid patients, that's on us. We set the rates for Medicaid reimbursement. If we would have a higher level for Medicaid, these providers would be able to do this. Do you realize that providers are losing money every time they accept a new Medicaid patient? That's because of us. And yes, we're putting more money in our community health centers. We're putting more money in free clinics. That's a good thing. But that's a recognition that there is a problem, that there is an uninsured problem, and we need to deal with that. And we could accept federal dollars. About $200 million could go to spend in other things in our budget if we would just say yes to accepting our money. This is not your money. This is not my money. It's not the Speaker's money. It belongs to our taxpayers. And we can spend our money better than anyone in Washington, D.C. I would take that bet any day of the week. And I know everyone in this chamber agrees that we can spend our money better than that. So, Mr. Speaker, you bet that Washington Post was way off. It's outrageous. It's unacceptable. And they do owe the Speaker and everyone in here who disagrees on that policy apology. I think that's way, way out of line. But we also know there are a lot of people hurting. 400,000 people need our help. Let's solve that problem, Mr. Speaker. Thank you very much.